Hi.
Hi.
Go ahead and have a seat for me. I'm Bella Robinson. I'm going to be your student nurse this morning to perform your head-to-toe assessment. Can you please state your name and date of birth?
Avila, June 14th, 1999.
All right, and how old does that make you, Abby?
19.
Are you currently a student?
Yes.
That's awesome. What are you studying?
Nursing at Posterior.
That's great. We always need more nurses.
Yeah.
Do you live on campus?
I do.
So you must eat at the cafeteria a lot.
Yes.
How's the food?
It's okay.
So you eat 3 meals a day, good
Yeah.
diet, have good appetite?
Yeah, for sure.
Okay, good. So today I'm just going to be performing a head-to-toe assessment. I'm going to start at your head and just work my way down. What brings you in today?
Just the head-to-toe assessment.
Okay. Do you have any pain?
No.
So on a scale of 0 to 10, how would you rate your pain today?
0.
Okay, good. So I'm just going to go ahead and start. I'm going to take a look first at your hands. So just put them out for me. I'm just going to flip them over. All right, so now I'm just going to look up to your head. Do you have any bumps or lesions you want me to be aware of?
No.
Okay, good. Tell me if anything hurts. Okay. Do you have any vision problems? Do you wear glasses?
I wear contacts and glasses, yeah.
Okay. Do you go frequent checkups?
Yeah.
Good. So first I'm just going to go ahead and dial your eyes. It's going to be a bright light. I'm going to have you look straight over my shoulder, and I'm just going to go ahead and bring the light in, okay? Good. One more time on this side. Now I'm going to come to this side. And one more time. Good. All right, so next, I'm just going to look straight at me, and without moving your head, I'm going to just ask you to move your eyes and follow my finger. Very good. All right, so now I'm going to have you cover your right eye, and I'm going to do the same, and I'm just going to have you say when you can see my finger.
Yeah, I can see it.
Okay, good. And now this side.
Yep.
Good. And now go ahead and switch sides. Tell me you can see it.
Yep.
Perfect. And this side.
Yep.
Good. So now I'm just going to have you close your eyes and don't let me, or go ahead and try to open them. Good. And I'm going to have you go ahead and raise those eyebrows for me. Let me see a frown. Smile, big teeth. Good. And go ahead and puff your cheeks. Perfect. Do you have any, have you had any trouble hearing?
No.
So can you hear this?
Yep.
What about this?
Yep.
Good. Any trouble chewing?
No.
So I'm going to go ahead and just feel your jaw. Tell me if there's any pain. Good. And go ahead and clench those teeth for me. And don't let me open. Good. So now I'm just going to move my way down to the neck. Actually, before I do that, I'm going to take a look in your mouth. Do you have any sores or lesions that are bothering you?
No.
Okay. And do you go to the dentist frequently, every 6 months?
Yep.
Good. And do you have good oral hygiene?
Yes.
Brush your teeth twice a day?
Floss, and mouthwash.
Good. Okay. So I'm going to go ahead and have you open your mouth for me. Go ahead and say ah. Perfect. I'm just going to take a look. Can you move your tongue up for me? Down. To the side. Good. Other side. Good. Okay. Looks good. And now we'll move my way down to the neck. Can you just say light, tight, dynamite for me?
Light, tight, dynamite.
Good. All right. So now, so go ahead and feel your neck. Do you have any pain, tenderness? Any difficulty swallowing?
No.
Good. Okay, so I'm going to go ahead and feel for your carotid pulse, so just relax. Good, they're both equal and strong. Now I'm just going to take a listen. So now I'm just going to have you do a couple of range of motion exercises for me. So can you go ahead and just look down for me? Go ahead and look up, to the right, sorry, to the left. Good. Any pain with that? No. Okay. Now can you take your ear and touch it to your shoulder? Other side. Good. Now I'm just going to push on your shoulders while you try to resist me. Good. Nice and strong. All right. So now I'm going to take a look at your back. But before I do that, do you have any cough? Any shortness of breath?
No.
Good. Okay. So I'm going to have you slide your feet this way. And can you go ahead and take this off for me? Thank you. All right, so I'm just going to go ahead, and I'm just looking right now. So any pain in your back at all?
No.
All right, so I'm just going to go ahead and palpate. I'm just going to feel around, so tell me if there's any pain. Good. All right, so now I'm just going to place my hands underneath the ribcage and ask you to take a big, deep breath for me, okay? Good. All right, so now when I place my hand on your back, can you go ahead and say 99?
Yep. 99. 99. 99. 99.
I'm going to just go ahead and lift this up, okay?
99. 99.
Good. Perfect. I'm going to do some percussion, so it's just going to be a light tapping with my finger.
Okay.
Just going to slide this over and start up here. Slide down here. Just going to go ahead and lift this up. I'm going to do it on the side, okay?
Mm-hmm.
All right, so now I'm just going to go ahead and take a listen. When I place my stethoscope on your back, can you just take a big, deep breath for me with your mouth open, please?
Yes.
How are you doing? Any dizziness, shortness of breath?
No.
Just let me know if you get dizzy, okay?
Okay.
Just going to lift this up. Very good. All right, so now I'm going to ask you to swing those feet around. Face me. Perfect. Do you have any chest pain at all?
No.
All right, so I'm just going to go ahead and feel around.
Okay.
Do you do your regular self-breast exams?
Yeah.
Good, those are very important. So I'm going to go ahead and do the same thing as I did in the back. I'm going to place my hand and please just say 99.
Okay. 99. 99. 99. 99.
And then I'm going to lift this up and just do it on your side.
99. 99.
Perfect. I'm going to do the same thing. I'm going to do some percussion with my fingers, so it's just going to be a light tapping.
Okay.
Perfect. I'm just going to lift this up again. Oops, sorry if I poked you. Okay. Good. All right, so I'm going to go ahead and take a listen.
Okay.
So again, when I place my stethoscope on, just go ahead and take a big deep breath with your mouth open, please.
Okay.
I'm just going to lift this up again. Perfect. So next, I'm actually going to go ahead and have you lay right down. Perfect. I'll slide this out for you. Okay, so first I'm just going to have you turn your head that way. I'm just going to take a look at your neck. Looks good. Now take a look at me. Good. Do you have any pain in this position?
No.
I'm going to go ahead and just feel again. Good. And next I'm just going to go ahead and to find your apical pulse. Good. So now I'm going to take a listen to your heart. I'm going to listen in a couple different areas, so it's going to take me a minute, but there's no need to be concerned, okay? Just go ahead and lift this up. So I'm going to listen to your apical pulse for 1 minute, so just relax for me, okay? Perfect. So now I'm just going to go ahead and take a listen to your abdomen, okay?
Okay.
Good. So now I'm just going to go ahead and do some tapping on your stomach, okay? How's your appetite been?
Good.
Good. Alright, so next I'm just going to feel around. I'm just going to start off lightly, but tell me if there's any pain, okay? Good. Now this time I'm going to go a little deeper. Great. So next I'm going to go ahead and take a look at your legs. Do you mind just sliding these off for me?
Yep. I can get them off.
Perfect. Alright, thank you. So have you had any numbness, tingling?
No.
Any pain, cramps? Okay. So first I'm just going to ask you to bend this. I'm going to go ahead and try to find your popliteal pulse, okay? So I can't seem to find it, but that's completely normal. I'm going to check this one, and if I can't find it, I'm going to get the Doppler.
Okay.
Now I'm just going to slide down here. I'm going to go ahead and check posterior tibialis pulse, okay? Good, they're both strong and equal. And those are also strong and equal. While I'm down here, I'm just going to test your strength in your feet. So I'm going to go ahead and apply some resistance. So you push. Good. Now the other way. Perfect. Your leg now, I'm going to do a couple of range of motion exercises. So go ahead and just lift your leg straight up. Perfect. And now the other one. Good. And can you bring this knee to your chest? Good. And your other one to your chest. Looks good. And now I'm going to test your strength.
Okay.
So I'm going to go ahead and just push down. Try to push up. Good. Now this one. Good. Nice and strong. So now I'm going to go ahead and have you sit up. And I'm going to test your arm range of motion. So I'm going to ask you just to do some circles with your arms. Good. Can you take both of your arms and touch your hands behind your back? Good. And put them straight out for me. I'm going to go ahead and push down. Don't let me. I'm going to push up. Good. Nice and strong. So next I'm going to go ahead and do some sensory tests. Test your sensation. So first I have this is sharp and this is dull.
Okay.
And I'm going to have you close your eyes and just tell me if you feel sharp or dull.
Okay. Sharp. Dull. Sharp. Dull. Sharp.
Good. Same thing. I'm going to close your eyes, and when you can feel this, just say yes.
Okay. Yes. 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 Yes.
Good. Okay, so next I'm just going to do some coordination.
Okay.
So first test, I'm going to have you take your index finger and go ahead and touch your nose and then my finger. And I'm going to move my finger around. Good, as fast as you can. Perfect. And now I'm going to have you take one of your hands, go ahead and take your thumb and touch each one of your fingers to your pinky and back. Good. Now do the other hand. Very good. And now go ahead and place your hands on your knees and go ahead and flip them back and forth as fast as you can. Good. All right. So next, this is coming to the end of the assessment, but I'm just going to ask you to stand up and we're going to do some walking.
Okay.
So I'm going to have you just take a couple steps this way. And then on the way back, can you go heel to toe? And then tippy toes and your heels. Perfect. And then I'm just going to have you stand in place with your arms together, feet together, eyes closed, just for a couple seconds, stand like that. Perfect. You can open. And now I'm just going to test your balance. I'm going to have you just stand on one leg and then do a slight squat. Good. And one more. Good. Go ahead and have a seat for me. One more test. I'm going to have you take that heel and put it on your knee and slide it down to your ankle.
Oh, down.
Yep. Perfect. Good. So that concludes our head to toe assessment today. Do you have any questions or concerns at this point?
No.
Good. Okay. It was nice to meet you.
Nice to
Have a
meet
good
you.
day.